Welcome back to Father and Son Investing. We're going to talk about Clover today. They did their quarterly earnings report. Of course, Hindenburg had some more mud to sling. We'll talk about that. And I'll give you my take on some of the questions that they included, including some from Reddit this time. Way to go, Reddit. That and more. Stay tuned. At 8:30 this morning, Clover Health announced their first quarter results. And the stock market did not take it well. We can see they've gone from around $7.70 per share prior to their announcement, down about $1 to around $6.70 per share now. What was it they announced that caused this drastic drop in price? It was definitely a good news, bad news kind of situation. The good news is that their membership increased year over year. They're up to a little more than 66,000 Medicare Advantage members now. That's an increase of about 18% year over year. Their revenue was also up. They did a little more than $200 million. That is a 21% increase compared to 2020. All right, so there's some good news. What's the bad news? Well, one of the pieces of bad news was that their medical care ratio, they call that MCR, that is the amount that they pay out divided by the premiums that they take in, that was 107%. That means that they paid out more in claims than in premiums that they took in. Never a great thing when you're a medical care company. Then they normalized it. What is that normalization about? Well, their costs really went up because of COVID-19 and increased utilization. And so if they wipe out some of those COVID-19 expenses, then they make it at 95.4%, which sounds better, but the bottom line is that they spent more than what they took in. What else is bad news? Salaries and benefit expenses, way up. Last year, $50 million. This year, $104.6 million. Why did it go up so much? A lot of that had to do with non-cash stock-based compensation of their merger. Remember, this was a SPAC merger that took place. That was the big bulk of it. So hopefully that was just a one-time expense and will not be a recurring thing over the next few quarters for this year, but that took a big hit on their bottom line. How are they doing on cash flow? They're doing just fine thanks to this SPAC merger. They've got $720 million in cash and cash equivalents / investments available to them. That a big bulk of that came from the merger. They got $670 million out of that. Now let's remember that this company operates out of two business models. They were recently accepted for the Medicare Direct Contracting Program. That started on April 1st, so that's one of the models. And of course, they've already been doing Medicare Advantage. When it comes to Medicare Advantage, their outlook, they're saying that they'll be at 68 to 70,000 members by the end of the year. That would be a growth rate right around the 20% level, so that's pretty good. From a medical provider's perspective, I see direct contracting as Medicare's attempt to shift the risk. Now, in exchange for assuming some of that risk, they attempt to make it easier for medical providers. That is the carrot. So how can they do that? They essentially make a small set of core quality measures. They provide some waivers to facilitate care delivery. And they make opportunities for organizations that are new to Medicare fee-for-service to participate. Remember, there are two types in this, the professional type and the global type. The professional type is a 50-50 risk-sharing way of doing business, and the global type, the healthcare provider is going to take on 100% of the risk with also 100% of the reward. Now, this is important to keep in mind. This program wasn't starting until 2021. It just started in April of this year. That's going to come in important when we talk about a tweet that Hindenburg Research sent out today. The direct contracting entity has a service area. The entity is the insurance company that Medicare is contracting with, such as Clover Health. They have a service area, a regional service area, and it is intended for them to compete within those areas with other DCEs. Lastly, we'll just cover this part because they were talking about it in the questions session after the report. Beneficiary alignment, these are the patients. They can align with the DCE in one of two ways. They can voluntarily do it, or based on the claims that the patient is submitting, they can be aligned with one of those DCEs. So having refreshed our memory about what this direct contracting is all about, Clover says they expect to have access to 200,000 Medicare beneficiaries. That does not mean that they will have a contract with 200,000 of them, but that's what they will have access to. They believe that they will end 2021 with somewhere between 70,000 and 100,000 total aligned direct contracting entity patients. So you can see that this is actually greater than what they will be doing through Medicare Advantage. Never underestimate Hindenburg's ability to sling mud. They quickly put out a tweet saying, hey, wait a minute, there's a problem here. In the pre-IPO slide deck, which really it was a pre-SPAC slide deck, but we'll pass on that. They stated that there were already 200,000 lives under contract. That is a true statement. Let's look at the slide deck. This is from the slide deck that was available when Chamath Palihapitiya got together with Clover and they did their little announcement. Here it is talking about direct contracting, 200K direct contracting lives already under contract for 2021. However, on the deep dive slide set that Clover has on their website that goes into a lot more detail, this was also pre-SPAC merger, this is what they had to say. They had spent 10 months trying to contract with physician practices. Over 50% of those practices had accepted a contract, and they expected 200,000 total lives in 2021. Very different than already under contract. I'm not sure why the pre-SPAC or the announcement slide set said that. I suspect somebody did not pay enough attention. When it comes to 2021 guidance, their revenue will be in line with analysts' expectations. They're estimating at 810 to 830 million in revenue. Their medical expenditures is just going to be almost 100%. It'll be 100% for the direct contracting patients and 94 to 97% of the amount of premiums that they take in for the Medicare Advantage patients. So not a lot of room there for margins. And then when it comes to their normalized adjusted EBITDA, still losing money, looking at minus 190 to minus $240 million. Now let's just get to some of the things from the question and answer period. They talked a little bit about home care. Clover is going to be getting involved in home care. That's not designed to compete with the practices that they contract with. That will be in addition to. So they see this as a plus for the physicians that they have contracts with. They also talked about Walgreens. They are participating with Walgreens in the health corners that are available in Walgreens stores. A patient of theirs can go into a Walgreens and get their BMI, their body mass index assessed, or their blood pressure, or they can get a flu shot. There are some things there that while they're in Walgreens, they could stop and get this taken care of, and then someone in Walgreens will add that to the Clover Assistant program that they have capacity to log into from Walgreens and update that information. So it's always good to try to capture data from patients or get a square filled like a flu shot whenever you have the capacity to do that. So that's a good deal with them and Walgreens. Interestingly, they also talked about MCR. Remember, that's that ratio of the amount of expenses they're paying out versus the premiums they take in. Of course, that was over 100% this last year. But they said something interesting, and that is that ratio goes down when the providers are using the Clover Assistant. And they also said that ratio decreases when they get outside of New Jersey. That's no knock on New Jersey. Everybody gets exposed to different things, and there are different lifestyles in different places. But it's good that this company can get outside of that small area where they're very heavily concentrated and start expanding into wider areas within the United States and get to different patient populations. Now, interestingly, they are a company that believes in the retail investor, and so they took some questions from Reddit this time. I heard 2 of them. Some of them sounded like they were a little bit of conglomerate of questions. Andrew Toy, the chief IT officer for Clover, made an interesting comment. He stated that the Clover Assistant had been tried with data from patients outside the United States, and that the Clover Assistant program performed equally well with those different data sets. That would be interesting to see whether at some point in the future Clover licenses this program for companies outside the United States, or who knows, at some point maybe they expand their ability to provide insurance into other countries. Someone asked a question about the SEC inquiry. Of course, that is on all of our minds. Until that gets resolved, Clover stock is really not going to be able to climb very well. And the rote answer was that they do not comment on pending inquiries. So we're not going to get anything from Clover out of this SEC inquiry. How else did the market respond today? Well, Bank of America is one of the analysts covering this company, and they cut their price target from $15 to $9. They say it no longer appears to us that the company will be able to meet its lofty membership growth targets after now missing its original Medicare Advantage and direct contracting guidance, creating more limited upside potential and lowering visibility. What does Clover Health have to do to get this stock price up and improve the bottom line on their company? A couple of things. One they can control is get more enrollees. They're really only going at 20%. In the past, they had been growing at 30%, so that's a decrease. And they've got to get more of these direct contracting patients. Even if they get to 100,000, that's just so far less than what they were predicting, 200,000. That certainly is hitting their stock price and their bottom line. What else do they have to do? They need to get out from under this SEC inquiry. They don't really have too much control over that. And the Department of Justice investigation, they don't have too much control over that other than cooperating. And they need to get this COVID-19 expense controlled. They do have a little bit of control with that. If they can get their enrollees vaccinated, then they can see their COVID-19 expenses decreasing. And they did talk about that on the conference call. They have been able to get a lot more of them vaccinated. Get the kids in your life investing and teach them. Until next time, enjoy your investing.